Welcome to the Maternity Mentor. Today we will be talking about gestational diabetes and how to prevent it from causing life-threatening complications for you and your baby. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Gestational diabetes is a serious condition affecting 7 to 10% of all pregnancies. Without treatment, both mother and baby can have serious complications. Let's explore what causes gestational diabetes and how to treat it. Gestational diabetes, simply put, is diabetes diagnosed for the first time during your pregnancy. Diabetes is a condition where your body doesn't process food the way it should. In diabetes, the hormone insulin, which breaks down sugar, doesn't work well, or your body doesn't produce enough of it. This causes your blood sugar to be too high, which can have serious consequences on how well your body functions. For pregnant women, gestational diabetes is very concerning because it can lead to complications and even fetal death. For most women, unfortunately, they will not have any symptoms of gestational diabetes. This is why receiving prenatal care is so important. It's usually during standard urine or blood tests performed as part of routine prenatal care that gestational diabetes is picked up. The most common test used to diagnose gestational diabetes is the glucose tolerance test, performed between 24 and 28 weeks of pregnancy. Some symptoms of gestational diabetes can include increased thirst, increased urination, and increased hunger. It's important to contact your healthcare provider if you're experiencing any of these symptoms so gestational diabetes, as well as other health conditions such as a UTI, can be ruled out. For more information on glucose tolerance testing and UTIs, please see our videos on this. We will link that in the description below. There are many risk factors associating with developing gestational diabetes. These include being over age 25, previous history of gestational diabetes, having high blood pressure or heart disease, obesity or being overweight, lack of physical activity or exercise, diabetes in an immediate family member such as a parent or sibling, racial background including African American, Hispanic, Alaska Native, Pacific Islander, American Indian, and Asian American, having polycystic ovarian syndrome or PCOS, having been diagnosed prior to pregnancy as having prediabetes, history of miscarriage, history of having a stillbirth or delivering a baby with certain birth defects, and previously given birth to a baby weighing greater than 9 pounds. Before we continue, please remember to hit that like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about the complications of gestational diabetes. There are many complications of having gestational diabetes that affect both mom and baby. If you're diagnosed with gestational diabetes, some of the complications you may experience include increased risk of developing high blood pressure during pregnancy, increased risk of developing preeclampsia, which is a life-threatening condition causing high blood pressure and other symptoms, increased chances of having a cesarean section delivery, risk of developing perinatal or postpartum depression, risk of postpartum hemorrhage caused by delivering a large baby, and increased risk of developing gestational diabetes during future pregnancies. Gestational diabetes also puts you at a higher risk for developing type 2 diabetes later in life. Complications your baby may experience includes preterm birth, respiratory distress or breathing issues at birth, macrosomia or large birth weight, birth injuries and shoulder dystocia due to large size and difficulty passing through the birth canal, hypoglycemia or low blood sugar at birth requiring intensive care and treatment, jaundice, obesity as an adult, and developing type 2 diabetes as an adult. Unfortunately, having gestational diabetes, especially with poorly controlled blood sugar, increases the risk of stillbirth or infant death shortly after birth. For more information on postpartum depression and postpartum hemorrhage, please see our videos on these. We will link those in the description below. Maintaining optimal blood sugar levels is the main goal in treating gestational diabetes. This is done through a variety of methods. The most important focus will be on what you eat. Proper diet can control or even eliminate diabetes. Your healthcare provider may send you to a nutritionist to assist you in learning what foods and portions are safe for your diabetes. It's important that you follow this advice because it can protect your baby. Your healthcare provider will also recommend that you start exercising because exercise can lower blood sugar levels. 30 minutes of moderate exercise most days of the week is preferred, but you must always seek clearance from your healthcare provider prior to starting any new exercise program while pregnant. Your healthcare provider will have you start monitoring your blood sugar 4 times per day to see how well the diet and exercise are working. If your blood sugar remains in the stable range, no other treatment will be needed. However, if your sugar remains unstable, your healthcare provider will start medication to control your blood sugar. Insulin is usually the medication prescribed, and the dosing will be monitored and adjusted for the remainder of your pregnancy. Finally, you and your baby will be monitored carefully to ensure that complications are not developing that could have a negative impact on your pregnancy and delivery. Preventing gestational diabetes starts with being a healthy weight when you get pregnant. Having a healthy lifestyle also reduces your risk. Make sure to exercise for 30 minutes most days per week, preferably at a moderate intensity. Eat a well-balanced diet, which includes nutritionally dense foods that are low in calories. Focus more on fruits and vegetables as well as whole grains. Start taking prenatal vitamins once you begin to consider getting pregnant. After you get pregnant, monitor your weight regularly to ensure you are not gaining weight too quickly or gaining too much weight overall. If you have gestational diabetes, your blood sugar levels should return to normal 1 to 3 months after the birth of your baby. Once that happens, you should be tested for type 2 diabetes every 1 to 3 years. If you do develop type 2 diabetes, your healthcare provider will develop a plan of care to treat your diabetes. Gestational diabetes is a serious but treatable condition. I hope this has explained what gestational diabetes is and why it's so important to prevent it or treat it properly. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.